Peroneal tendon subluxations usually occur after lateral ankle sprains. They can be challenging both from a diagnostic as well as a treatment standpoint. In this Ask the Doctor video, I explain what the injury is, how the diagnosis can be made, and when surgery is necessary. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best, regardless of age or injury. And as I said, this video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on this channel. The question from a viewer recently is simple. An MRI scan is not 100% accurate with identifying ligament tears. I hear the clicking of peroneal subluxation with eversion of my foot, but my MRI scan did not detect the torn retinaculum. Either it was too subtle, a tear to be visible, or the radiologist did not interpret it correctly. Perhaps a dynamic ultrasound is better for showing subluxation. Another possibility is that my retinaculum could be overstretched, which allows the peroneal tendon to slip out of its groove. Regardless, my orthopedic surgeon suggested surgical repair. I have no interest going through that. All right, before I get to lots of different points here, this response here is not medical advice. In none of my videos on any social media channel or on my website, I am never giving medical advice. This is meant for general information and educational purposes only. Now, they're not shown on this model here, but the peroneal tendons are two tendons that run behind and under the tip of the fibula on the lateral malleolus on the outside of the ankle. And with an inversion injury, the tissue, the retinaculum that holds those tendons in place can tear. It's not super common, but it does happen. And then what happens when that retinaculum tears is those peroneal tendons, or one of the peroneal tendons, can slip back and forth across that bone. It is not subtle when that happens. At first, sometimes it can be just partially subluxing, but in people that it slides back and forth, you know it. It's not subtle, and that's where sometimes an MRI is not even necessary. You know that's torn, especially in an acute setting. That's going to be something that an orthopedic sports medicine specialist or an orthopedic foot and ankle surgeon is going to recommend surgery. The reason being is if that tendon keeps slipping back and forth, that bone is going to fray it more and more, and eventually it ruptures. So you typically fix that retinaculum to hold it in place. Also, it's just going to keep happening. There's no non-surgical treatment for that. There's no taping. There's no physical therapy that I'm aware of. No regenerative treatment, whether that's peptides or PRP or autologous exosome, anything that's going to get that to heal without surgery. So treatment is almost always surgical if there is a retinacular tear and subluxations of the peroneal tendons. Now, diagnostic testing, MRI can be a little difficult to diagnose. You have to catch the image. This has to be in the plane of that retinaculum. And I can see where the radiologist might struggle to do that if he or she does not know exactly what the doctor is looking for on that test. Yes, a dynamic ultrasound where you put the ankle through a range of motion and demonstrate that tendon subluxing would be helpful. But again, if that tendon is fully subluxing, you know it by physical exam. So you could make a pretty good case that if it's doing that, you don't need either of those tests. You just need to proceed with surgery. But if you want to be sure, or the other reason to get the MRI would be to see if there's any other damage that you might fix at the time of surgery. I hope that information was helpful. If you have an orthopedic injury and you want to hear about options other than surgery, other than quick fixes like cortisone, click the link in the description under this video, fill out the contact form, and you can learn more about scheduling an appointment to see me as a patient. I'd also love to hear about your experience with your orthopedic injury. You can leave those in the comments below. Just understand, if you leave a question in those comments, I can't respond with medical advice, but I can answer your question in a future video like I did here. Make sure to subscribe to my YouTube channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.